Hello, my name is Annalie Martin, and today I will be going over the different types of medication administration. So the first one I'm going to be talking about is buccal, and that is usually in like a tablet, a film, or a spray. The patient places the tablet between their gums and their cheek, and then the medication will dissolve. You're going to want to make sure that the patient doesn't drink or anything, and make sure that you stay with them until it does fully dissolve, just so you can make sure that you can properly document that they did take the medication, because it may start to dissolve, and then they may they could remove the medication, and then at that point you wouldn't be able to accurately document that they took the entire dose. The next one is going to be eardrops. Now with that, I think a lot of I've had to do eardrops before, but I was a little bit surprised that I may not have been doing it correctly, because so with the eardrops, the patient is going to lay on their side, and they're going to lift their head to the highest point, and then you're going to pull the canal up and back. For a child, it would be the opposite. You wouldn't pull up, you'd pull down. And then you just want the drips to fall like into the ear. You don't want to ever touch inside the ear. And then you will press on the tragus and just make sure that that all of the drops, just to make sure that all of the drops go. And that's one thing that I never knew and I never did. Another big one is you want the patient to lay on their side for 5 minutes between each. If you're just doing one ear, you put the drops in, then the prescribed amount, and then they lay for 5 minutes. If they're doing the other ear, it would be the same thing. Put the drops in, wait 5 minutes. So if they do have, if their tympanic membrane is not intact, that is something that you are going to want to find out, because that could, that could mean that you have to make sure that everything is sterile. And beforehand, one thing to keep in mind is you're going to want to check for drainage. Sometimes you would just take and wipe the ear off if there was, and then you would be able to perform that. But if it was like an excessive amount of drainage, obviously you would want to let someone know. But if it's just a small amount, let the doctor know. But if it was just a small amount, then you could just wipe that off and make sure that the drainage is out of the way before you start. Now with eye drops, you will want the medication. You'll want your gloves. And in this case, you're going to have the patient. You're going to ask them to focus on the ceiling. And then you're going to pull their eyelid down like this, and you're going to want to keep that bottle away from the eye. You never want to touch the eye, because you can damage the eye. And then you want to squeeze the drops, and you want them to fall into the conjunctival sac. And you're just going to let the drops fall, the prescribed amount of drops. And then with certain medications, you have to, with obviously clean hands, you'll have to kind of rub and hold very gently the inner portion of the eye, just to make sure, just kind of just apply gentle pressure there. And then when they're done, you're going to want to just stay with them, make sure that they can see. Just make sure that they didn't have any adverse reactions or anything to the medication. Now with inhalation, there are a few different types of medications that you would inhale. One that I'm most familiar with is going to be an albuterol, because I have had to take albuterol before. So when you are giving a medication that a patient needs to inhale, you want to, of course, first, if there's any assessments that you need to do first, you want to do that, whether it's checking their vitals, anything that you need to do before that. And then you are going to you're going to want the patient to place their teeth all the way over and make sure that their lips are completely sealed, and then tell the patient to breathe in strong and deep for longer than 2 to 3 seconds, and then you want to wait. Usually it'll say how long they want them to wait, but after that you want them to wait, and then if they want, they can rinse their mouth out or whatever they need. Now with the rectal suppository, that is another one that you are going to want to have gloves. You're going to need lube, maybe some tissue in case the patient needs to clean up there. So you're going to want to just raise the bed so that it's at a comfortable working height. Your patient is going to be on the side in the Sims position, just like we. This one did kind of remind me of some of the same things to remember, like with enemas, because it was kind of the same thing. Like if the patient had like any type of bowel obstruction or abdominal surgery, then that's a time, or like hemorrhoids, that's in that case you would want to more just be more mindful, and you may want to not perform the procedure. And if the physician prescribed that, you may want to double check and just say, well, they just had abdominal surgery or anything like that. So you will remove the suppository from the wrapper. Obviously you'll have the gloves. You'll want to stick the lube on your finger and on the suppository, and then you will want to take the gloved finger, and you'll want to insert you'll have to insert that into their anus. So with that, you're going to want to document the date, the time, the med, and the dosage route. And they do say that when you insert it using your finger, that you want to do about 3 to 4 inches. Obviously with that area, you want to be very careful. So the next one that I'm going to be talking about is the sublingual. So for that, you're going to need the medication. You're going to want to, of course, check the EMR, and you're going to want gloves. So with that is going to be under the patient's tongue. So you're going to want to make sure that it's placed under the patient's tongue, and then they're going to wait for that to dissolve. And with that, the biggest thing that you're going to want to instruct the patient is not to swallow. The medication. Make sure that they let it fully dissolve, and wait to have fluids until that is fully dissolved. Now with the topical, I know, like, I have for things I just always, to learn, I try to think of like things that I used with a topical cream that I have used would be like Lotrimin. When I was a kid, I think I had like ringworm, so that was like one topical ointment that I used. So with that, I know that you do want gloves. You would definitely want to assess that area on the patient, and document any abnormal findings beforehand, because otherwise it could be like a side effect of the rash. So you want to make sure that you assess the area where you're putting it first, and then you'll want to just apply like a thin layer of the cream or ointment to the area that it is needed. So with a vaginal suppository, with that you're going to need gloves. Sometimes you'll want like a perineal pad in case any leakage comes out, and then you'll have your vaginal suppository, and usually they come with sometimes they'll have something that you insert them with. But if they don't, the example in our textbook that I found was that you're going to use your finger. So the patient is gonna want to be laying down on their back with their knees flexed, and you're going to want to spread the labia with your fingers and clean the area. Of course, you'll be doing this with gloves on. You will remove the suppository from the wrapper, and kind of like the rectal, you're going to want to lubricate the suppository. And you're going to want to lubricate your gloved finger, and you're going to insert that the full length of your finger. With this, of course, you're going to want to make sure that patient has privacy, and then you're going to want to have them lay down lay down for at least 5 to 10 minutes, just to make sure that the suppository doesn't just come right out. And sometimes these are just given before